Hi, I'm Dr. Julie Steinauer, and today I want to talk to you about poor comprehension and some reasons as to why that might occur. Now, before we hop into the details of our video, let's talk about how you can connect with me. If you're local, give us a call at 618-288-1489. If you're not local, which means that you might live in a different state or you might be in a different place in the world, then you can go to our website at visionforlifeworks.com. You have two options. You can either fill out a questionnaire or you can click the schedule a consultation button with me if you'd like to discuss how we might be able to help you no matter where you are. Now let's go back and discuss poor comprehension. So this can happen in any age range. It can happen in children, it can happen in adults. Maybe you are an adult who had some comprehension issues with reading whenever you were a child and it just carried over. So really this video is going to be directed at anyone who has experienced it or is still presently experiencing it. But poor comprehension can come from a host of factors. So one of the reasons why we may have poor comprehension is possibly losing our place with reading. So this can come from a tracking problem, and if someone is reading, and let's say they're reading along a line of print and they're trying to go from left to right, but their eye jumps out of alignment up or down or tends to jump back because of a tracking problem, then that may mean that they have a tough time remembering what they've read. It's kind of like it might be so difficult for you just to try to keep your place, like using your finger to keep your place with reading, that there's not a lot of room left over for comprehension. Now, there can be other things besides tracking problems. I did kind of allude to this when I said you may jump up or jump down. That might actually not come from a true tracking problem. It may come from a misalignment of your eyes, like a strabismus. So if you have an eye turn where the eye turns in or out, or if the eye turns up, or, we talk about those frequently, but there are also kind of diagonal types of eye turns. If one of those things is occurring, then as you're reading from left to right along a page of print, your eye may jump up out of alignment or jump down as a result of maybe like an up and down movement of the eye. So a strabismus can cause you to kind of look like you have a tracking problem too. And either way, if your eyes are doing this, the brain is confused about the information that it's taking in. It's taking in information from one eye, and then whatever the other eye might be doing, it's also taking that in. If that information is conflicting, then the brain has to figure out, what do I need to do in order to comprehend what I'm reading here? Maybe it needs to shut an eye down that's kind of misaligning or not behaving the way that it needs to behave. And if that's the case, again, comprehension can be reduced. Maybe what happens for you or for your child is that you find yourself skimming stuff so quickly that what you do is you kind of word guess. Okay, word guessing is really frequent and common, so as the child is reading across a line of a page, they may see a word, and I use this one commonly, but the word might be chair, and they may blurt out Christmas. Maybe they've got Christmas on their mind, but they see some of the letters that are in chair actually do exist in Christmas. And so they may be reading along the line of print and they blurt out a different word than what's actually on the page. This one, that word guessing, obviously that causes problems. It can change the entire meaning of a sentence or paragraph if they're guessing words that aren't really truly in that paragraph of information. So that's another reason why we may see something like a poor comprehension. We can also notice this if someone is ignoring one eye. Again, that can come, as I mentioned a bit earlier. If they're ignoring an eye, it might come from them crossing an eye too much, an eye going out, an eye going up, an eye kind of going at the diagonal. So it may come from a strabismus. It may come from a generalized binocular or two-eyed vision disorder like convergence insufficiency, where children or adults have trouble crossing their eyes and lining them up to a specific target so that both eyes are pointed to the exact same thing as they read along that page of print. So this is another reason why we may notice something like poor poor comprehension. Now, I've given you several examples. Obviously, there are many other reasons why a person could potentially have poor comprehension, but those are some of the most frequent things that we see and know about in vision problems. Now, if you're thinking, well, this is me or this is my child, and you want to connect with us, well, if you're local, just call us at 618-288-1489. If you're not local, go to our website, and there are two options there for non-local individuals, which is to fill out the questionnaire form, or you can fill out the schedule a consultation. There's a little button to click on. Now, if you like this video, hit the like button. We'd love it if you pass it on to someone and share it. And also, if you haven't done so, subscribe to our YouTube channel. Thank you.